This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
There we go. Oh, and throughout, feel free to leave your questions in the chat. I'll look at it every once in a while, and then I'll answer at the end. All right, sounds good. So again, my name is Cindy. I'm a third year here at our program. So I'm in my second out of third years. And our program is called Casa Colina. It's associated with OPTI West. And I'm here to talk to you about why I love it so much and why you should come. All right, so I think this slide is here because when patients come to our hospital, the first thing they say is, hey, it looks like a resort, not a hospital. And I think they want to show off how beautiful it is. So here you are, the mountains in the background. We're in the lovely Inland Empire. And then we are the largest standalone rehab hospital in that area with 68 beds. We also recently expanded with a med-surg wing as well as ICU beds as well. All right. So, like I said, we're ACGM accredited. We're associated with Opti West. We are a 3-year advanced program. So we have 3 residents per year. So, and then 9 total. So you'll have 2 other co-residents if you come here, which is very fun and exciting to take a little family. Our main place to go to is Casa Colina Hospital, which is our rehab hospital. We also have our transitional living center, which is kind of, if you've never heard of it before, it's almost like between acute rehab and subacute, where we have intensive therapies. It's a very unique program that we have here for our brain injury mostly, and other, as well as spinal cord injury patients. I'm happy to talk more about that if I have time at the end. Our other rotation sites are CHLA, where we do peds. We have neuromuscular with our lovely Dr. Yagayan at Pasadena, neurology group. We do a lot of rotations with our orthopedic surgeons, as well as California Sports and Spine, just to name a few. All right. I'm not sure why the photos look like this. Sorry, it looks very jank, but you get the idea. Dr. Phillips at the top is our wonderful program director, and I'll introduce some of the other core faculty really quickly because unfortunately they couldn't be here. Dr. Patterson is a specialist in TVI, I apologize, and then Dr. Huang as well. Does a lot of our procedures with us. Also Dr. Saino and Dr. Frey, wonderful people that I'm happy to talk about more, but I want to make sure we get through all these slides. And okay, it's good. All right, and like I mentioned, some rotations are as follows. So pediatric CHLA, we do interventional pain with a group with Dr. Muradian and Dr. Lynch as well at their sites. Oh, there we go. Okay. We also have pretty good MSK and sports medicine coverage with Dr. Patel and Dr. Bass, who are both our orthopedic surgeons. We go to clinic and to the OR with them. They do a really tight MSK exam, so we're really grateful to learn from them. Dr. Yagayan with neuromuscular at Pasadena as well. And then we do EMGs mostly, actually this is recently updated with Dr. Apelian, as well as we do EMGs in our clinic as well, but I'll talk more about that in a little bit. But it has recently changed where now our EMG rotation is with a different group because we just felt like it was a better learning experience. And then the program was kind enough to listen to our concerns, like, hey, maybe we could get better EMG experience if we do it at our clinic, and also with another faculty that we really liked. And that's what's changed recently. So I think it's definitely changed for the better. We also have P&O with our lovely associated P&O group, which is J&K Orthopedics. We work very close with them, and we have a really good P&O foundation, in my opinion. Not biased, obviously. Here are some pictures of us learning about P&O. All right. We have wound care and hyperbaric oxygen actually in the hospital itself, and we have faculty who does that. So we have patients who get hyperbarics on the inpatient side, and then we learn from our lovely wound care team as well. And then finally, our transitional living center, which I think is one of the really unique things about our program. We have a really robust program here for brain injury, spinal cord injury. They have 6 hours of therapy a day. It's one of Dr. Patterson, one of our faculty's babies. Basically, he's so proud of it. We're really happy to be able to see this unique model in practice. It's just a really wonderful experience to see, patients who are just coming out of acute rehab, but for example, they have a severe brain injury. That transition to home is often very hard, as you guys may know. So this just getting them from acute rehab back into home integration and community integration. That's obviously a reason why you chose rehab in the first place, right? Reintegrating people back into their homes. And it's lovely to see that we have that program and it really helps patients transition home. All right. So just a breakdown of kind of what our curriculum entails. We have most of our inpatient, like a lot of programs in PM&R, a lot of the inpatient is front loaded. We also, okay, just checking, sorry. We often have most of it front loaded for our PGY2. So it's 10 months of inpatient, which I think, so you guys will decide for yourselves whether you like a program that has kind of interspersed inpatient throughout the entire time, or if you like the more front loaded. But just a plug for why front loaded is better, in my opinion, is that you really master the inpatient skills that you have when you just have kind of it all together. And you really, as opposed to just switching between outpatient, inpatient, different electives. That's my plug for why I like it front loaded. But you guys make your own choice about what you guys think is good for you. And then we have a little bit of inpatient throughout PGY 3 and 4 years as well, about 2 months each. Our outpatient is mostly PGY 3 and 4 years. Where we do that, it's a lot of spasticity, workers' comp, med legal. We have a lot of diversity of what we see in clinic. We do a lot of EMGs, we do a lot of P&O, and I think what's really unique about our program is we do a good amount of workers' comp and med legal, so you can see kind of, unfortunately, when you go out into the world, you're going to have to learn the business of medicine and med legal terms and workers' comp. So having that tool in your tool belt, I think, is really valuable, and we get that a lot here. We also have gate rounds and rehab rounds throughout the year which feature many of our inpatient patients who are gracious enough to let us examine their gait, talk about their gait. So I think it's a really wonderful experience there as well. All right. Gosh, I don't know how to use PowerPoint. Okay, here we go. Here is a sample rotation. So as you can see, PGY2, like I mentioned, was heavily inpatient focused. So 10 months, which, you can decide whether you like that kind of thing or you don't, but you heard why I like it. We have PGY 3 and 4, which is a lot more outpatient. We have pediatrics, we have outpatient, which is the purple, and EMG, as well as orthopedics and electives. So I think it's a pretty good smattering. All right. So just other logistics, other programs that you guys might want to hear about. So our call system is home call, so you take it from home. It's progressively decreases throughout the year. So PGY 2, 7 weeks, 6 weeks, and 5 weeks, respectively, as you get more senior. How it works is you're on call for a week at a time, as most programs are. And then during the week, you do your regular rotation, and then they call you at night. On the weekends, you come into the hospital, and then you do all of the new admits. You also take calls. So you take call from both the acute rehab that we have, our 68-bed, as well as the TLC, which is our transitional living center. What I really like about our program is that we also have a nocturnist here, so internal medicine from 9 p.m. to 6 a.m. So if it's like a code or a rapid, for example, you're not expected to go into the hospital. We have a doctor there just for that. You field a lot of the other maybe rehab related questions or smaller things. So it's not like it's not as intensive because you don't have to go into the hospital in the middle of the night, which, oh, thank God, we get a lot of sleep. It's wonderful. And then Vacation-wise, there is 15 days of PTO plus 6 federal holidays. That's a total of 21 days. And then we have 3 days of paid sick leave. And then conferences as well. We go to conferences and that doesn't take PTO. Okay, so our didactics are structured on Fridays. So we have 3 hours of lecture on Fridays from 10 a.m. to 1 p.m. We also have some lectures during the lunch hour throughout the week, not every single day, but just throughout as we see fit. It's given by attendings, by residents, internal and external attendings that we invite. And then we also get lectures from certain specialists in other fields. For example, our prosthetics and orthotics is given by a P&O expert. We have, outcome measures given by the therapist because they're the real experts in that. We have board review, which is, a 1 hour lecture every Tuesday. We have journal club, and then we also do cadaver lab. Very kindly, Western U has allowed us to go into their anatomy lab and then dissect and look through the joints. It's really wonderful. So that's a great experience that we get as well. Okay. And here are just some pictures. This is mostly during COVID, which is why everyone is still wearing their masks, of just like learning about wheelchairs with the different residents. Braces, that's Lindy, our grad. Okay. Some other things that I'll quickly run through because I want to be mindful of our time. Basically, we have a standalone research institute that is associated with our hospital. They do amazing stuff there. We have a VNS trial, et cetera, ongoing that we participate in. It's just a really wonderful resource if you're interested in doing research, to work with people who have a more background in research. We're doctors, but we're not like research specialists necessarily. So we have this wonderful team to help us, guide us, and their doors are always open. So it's a great thing to have as well on our campus. We also have a bunch of committees, us as residents. I don't know how normal this is for other residency programs, but we are involved in several committees at once. For example, I'm on pressure injury, we're on peer review. We do a lot of different committees and are very involved in the hospital. And given that we're the only residency program in the entire hospital, I think it's really wonderful that they have incorporated us into all their committees, and we really make a difference and contribute to them. Okay. We do sports physicals every Monday afternoon with our orthopedic surgeon, Dr. Bass. It's a great way to learn your MSK exam, volunteer. We do it for local high school students. It also is a sports injury screening as well during that time. And our brain injury specialist, Dr. Patterson, he is often doing sideline coverage for local high schools. So we are often invited to do that. It's a really fun experience if you're interested in sports and MSK. I know our chief is, so it is a really wonderful opportunity. Okay. All right. Oh, these are just some of the amazing events that we've had in the past. Oh, our cute little residents. Sorry, these photos are a little bit outdated, but if you want to see updated photos, feel free to go to our Instagram. It's Casa Colina _ PM&R Residency. But here are just some of the events that we participate in and volunteer with. Here is our lovely therapist and the previous residents that we had. On the left, we do a skit every year, and all the residents always get roped into the skits with the therapists. It's a really fun time. That's what you're seeing there. And then resident wellness. We care a lot about making sure that we're, all of us are healthy, both mind and physically, obviously. So we do things together. We hang out in and outside of residency. And here are some examples of that. Oh, baseball game, and then we hang out just in our homes. We do Christmas parties, that kind of stuff. All right, and here are some more examples of that. Oh my gosh, our cuties. Okay, so, oof, wow. Okay, so here are just examples of what our previous residents are matched into. So I will, Oh my gosh. So here are some alumni. I'll kind of brag about how wonderful our alumni are. So here are all the places that they've gone to. We're a relatively new residency program, but I think if you want to do basically anything, we've had someone match there. So feel free, if you specifically want to do a certain fellowship, feel free to ask about that. And I'm happy to talk more about our alumni specifically who've gone into that. But here are some of our recent grads and what they're doing. And I don't think this includes our most recent graduates from this year, so I'll briefly brag about them. Preston Hatch, it was our chief resident. He's now doing general PM&R in Arizona. Edward Anton is doing a brain injury fellowship at Mayo Clinic in Minnesota. And then Nate is doing interventional spine in Pennsylvania. We're very proud of all of them. I'll quickly wrap up, sorry. This took a little bit longer than I thought, but I think what makes our program really special is the attendings are really invested in us. It's a 1-to-1 ratio, which I think is really rare since we are a small program. I know everyone says like, oh, we're a close family culture, and obviously it's hard for you to tell through the Zoom screen what our culture is like, but I guess you'll have to trust me on this one. Our therapists and nurses and staff and attendings, we are all so close, and I think that's what really makes us unique. I know it's hard for you to tell, and it would only make sense if you come and rotate with us, which I welcome you to do. We have a lot of med students every year. I think that's what really makes us special. And then we are in SoCal, which of course, you know, great place to live. One of the reasons I came here is because I'm from here and want to stay here forever. So if you're from SoCal or you want to come to SoCal, that is also a great reason, right? That's essentially it. I think I only have a couple minutes left. I'm sorry I spent so long, but feel free to ask me questions in the chat or unmute yourself. I know that's a bit scary, but feel free to ask questions in the chat.
Thank you for a wonderful presentation. No, you have great timing. We have about 4 minutes for questions.
Oh, phew. Okay.
All right, excellent.
Okay, I got a question. Have we had IMGs in the past? Yes, we have. Our first class, I don't remember exactly where they're from, but I can get back to you about that if you want to email me. And then, is there a step 2 CK score cutoff? There is not. And then I'm going to put my email here. You guys feel free to email me. Sorry, I'm typing as fast as I possibly can, which is not very fast. Are there any exciting or interesting developments that you have heard about the residency program in the upcoming years? Yes, so actually this ties well with another question that I got about ultrasound didactics. Yes, so our chief this year, who's Curran, he is going to sports medicine, and his passion project is to create a MSK and ultrasound curriculum for us, which I think was one of the things that we were lacking. We have petitioned our program director to get portable ultrasound, which is amazing. That's in the works. And we're going to do ultrasound club, and we're going to have, and Curran is going to spearhead an MSK series in our lectures. So that's really exciting. What other, let me try to think about it while I answer another question. Is there a research track? There is not a track for it, but we do have the Casa Colina Research Institute that does a ton of research, gets published widely. So if you're interested in research, feel free to come. We still have a wonderful program for that, even though it's not an official track. Okay. All right. I think that's it. And I think I've run out of time too. So you guys are perfect timing. Wonderful. Feel free to email me if you have any more questions. I'm always available through email. We were in your shoes not too long ago, so feel free to contact us if you have any questions. Lovely to meet you all.